Meet lung A and lung B. Same body type, same age, 25 years old. Lung A has never touched a cigarette. Lung B had its first one at 16. Right now, lung A is expanding cleanly. The air rushes in through smooth pink airways, the bronchi branching like a tree into smaller and smaller tubes, until oxygen reaches tiny air sacs called alveoli. Each one inflates like a perfect bubble. The walls are thin, elastic, and rich with capillaries. Oxygen crosses straight into the blood. Carbon dioxide crosses back out. The whole system takes less than a second. Lung B is doing the same thing right now, but the journey looks different. The airways are lined with a thick layer of sticky mucus. The cilia, tiny hair-like structures that sweep debris out, have been partially paralyzed by years of smoke exposure. The bronchi walls are thickened and inflamed, narrowing the passage. Air still gets in, but it has to push harder to get there. At the cellular level, lung A's alveoli are pristine. Each sac is intact, flexible, and surrounded by a dense web of healthy capillaries. The surface area available for gas exchange in a healthy lung is roughly the size of a tennis court. Lung B has started to lose that surface area. Some alveoli have merged together, their walls broken down by an enzyme the body releases in response to smoke toxins. This is called emphysema, and it is irreversible. Where there were once thousands of small, efficient bubbles, there are now fewer, larger, saggier ones. The tennis court has shrunk. Now, watch what happens when lung B inhales a cigarette right now. The smoke carries over 7,000 chemicals. As it enters the airways, the cilia that remain flatten against the walls. The mucus thickens immediately. The bronchi lining swells. The smoke reaches the alveoli, and the fine capillary walls absorb the chemicals directly into the bloodstream within 8 seconds. Lung A is still just breathing air. In the bloodstream, the difference compounds. The blood leaving lung A is rich with oxygen, bright red, moving cleanly through elastic vessel walls. The blood leaving lung B carries carbon monoxide, a chemical that binds to red blood cells 200 times more effectively than oxygen. Those cells are now carrying the wrong molecule. The heart compensates by beating faster and harder to get enough oxygen to the body's tissues. Over years, this sustained pressure thickens the heart muscle and stiffens the artery walls. The immune system tells another story. Lung A's immune cells, macrophages, patrol the alveoli quietly, clearing out any dust or bacteria that gets through. They work efficiently and retire without incident. Lung B's macrophages are overwhelmed. The volume of toxic particles arriving with every cigarette is more than the system was designed to clear. The macrophages release inflammatory signals as they struggle. Those signals attract more immune cells. The chronic inflammation they produce damages the very tissue they are trying to protect. This is the mechanism behind chronic bronchitis, a permanent state of airway inflammation that produces the smoker's cough. Both lungs are now 35 years old. Lung A looks almost identical to how it did at 25. Its airways are clear, its alveoli intact, its capillaries healthy. Its owner can run, climb stairs, sleep deeply. Lung B has aged 20 years beyond its biological age. Its airways are scarred and narrowed. Its alveoli are visibly enlarged and damaged. Patches of its lining carry cells with mutated DNA, cells that have been repeatedly exposed to carcinogens like benzene and formaldehyde. Those mutations have been accumulating silently for years. The immune system flags some of them and destroys them, but not all. Here is the one thing both lungs still have in common at 35. It is not too late for lung B. Within 20 minutes of the last cigarette, blood pressure begins to drop. Within 12 hours, carbon monoxide levels in the blood normalize. Within a year, the excess risk of heart disease halves. Within 10 years, the risk of lung cancer falls to half that of a continuing smoker. The damage already done is permanent, but the body's capacity to stabilize, compensate, and partially recover is remarkable. Lung A never needed saving. Lung B still can be.